Thank you, everyone, and thanks for being here today. A big highlight of the trip is being able to share our experiences with our classmates and our colleagues and our friends. So I just want to start off by introducing Dr. Jennifer Morton, who is going to get us started here today. Dr. Morton is the director of the nursing program here at the University of New England, and she is really the driving spirit behind this whole Ghana immersion and all the trips. Jen brought this program to UNE from when she was a doctoral student at University of Massachusetts. She participated in the program then and then firmly brought it here, and now it's clearly established at UNE. And, Jen, the planning of it, being there, the implementation of it is really all Jen is that driving force. She's always the final yes that you have to get when you want to do anything. So even I ask. I'd like to introduce Jen, who's going to get us started. We have several students who are going to present part of the slides today, and so we'll be mixing and matching, and hopefully we can share some stories and answer some questions at the end. So Jennifer Morton.
Thank you, Dennis. I wouldn't say that's entirely true. So Dennis has evolved into one of our faculty partners that participates every year in this program, and he ran a clinic by himself this past summer, right? Okay. So this program is very, very different from any other cultural immersion short-term program that you'll find anywhere in the country. And we're really proud of what makes us stand out, and we are starting to be really recognized for some of the things that make this stand out. And really the difference is that we don't consider ourselves to be going over to a country that may have fewer resources than us and doing great things. We consider this to be a learning experience, and so the purpose of the program is fully and foremost to provide students with an experience that serves to heighten their cultural awareness and sensitivity. And I think any one of these students sitting over here will say that that is absolutely true. Incidentally, this past summer was our largest group. We had a total of 38 folks go. 30 of those were students, and that was the largest group we've had so far. Another purpose is to provide primary health care and related services to the citizens of Sekondi, Takoradi, Kansawarado, now Mpintsin. We have another community that we're going to be adding. And so that's really our secondary goal. And the third, there's some emerging public health research agendas being developed, but none of this happens without partnerships. And I have a really special guest today that I'm going to introduce you to. Our partnerships over in Ghana include the Ghana Health Service, so the health service that oversees all public health activities, all acute care services, clinical services, as well as a local university, a large university. If we were to sort of equate the size, it would be about the size of probably the University of Massachusetts Amherst. You have about 20,000 students at the University of Cape Coast, which is about an hour away from Sekondi. And also our local community leader, Reverend Robert Ando, who's our host. I'm going to introduce you to a very special guest. His name is Dr. Kaberu Azeez. He is the medical director of the University of Cape Coast Hospital, which is a large hospital that's part of the University of Cape Coast system and serves to educate their medical students, their nursing students, their optometry students, number of health professions. He is a surgeon by training. He's an ear, nose, and throat surgeon. Still practices 1 day a week in the OR, as well as overseeing all of the clinical operations, all of the quality improvement efforts, and all of the activities that have really changed the landscape of healthcare in that institution. And I'd like for KK to say a few words. He agreed to do that. He's been here for about 3 days. This is his second visit to Maine, and it's always a pleasure. KK?
Jen, members here present, I'm humbled by this invitation to share a few ideas with you. I apologize with my African accent. You need to bear with me. I'll try as much as possible to speak slowly so that you can follow what I want to say. But I want to say I'm really impressed by this turnout. I'm impressed by the students and faculty with whom I worked in faraway Ghana, Africa, specifically University of Cape Coast. But what I see more is the hope, the future of the collaboration is what is my motivator. I'm motivated by the fact that we would be working with youths, experienced faculty, to advance the common interests of our two people and two nations, Ghana and United States of America. And in some presentations I made in Yale some years back, I really showed a lot of collaborations that both countries have enjoyed over the years, upon which we are benefiting. And it is our intention to also leave good legacies behind for people to follow for the future. And I think if I'm taking nothing home at all, it is hope for tomorrow that I'm taking on. UNE and University of Cape Coast have shared common things over the years. This is my 4th time of coming here in 3 years. But 1 year I came twice. I left and I was in New York and I was called back to meet some other person. So I had to come back twice within a visit. But we share common interests with other universities, like Grand Valley State universities. I'm going to go to Philadelphia tomorrow, and we have some relationship with George Washington University, University, and so many other universities. But UNE's collaboration is fantastic. And I was discussing with Jen that what I saw yesterday and today has really convinced me that if I have an opportunity to come here, I would come even tomorrow to come and share with you the experiences that we have and to build partnership to advance the interests of our common people. Once again, I'm very happy. I bring you felicitation and salutation from the people of Ghana, the president of my university, my humble self, and my staff says, Ayiko. Thank you very much. I'll talk more later.
One thing I'll tell you about Dr. Azeez is that he rallied, I believe, 6 or 7 physicians, 3 or 4 nurses, 5 or 6 folks from the optometry school, a number of health professionals to work with us the 2 weeks we were there. And he practiced right alongside the students and all of the faculty that were there, learning with, about, and from each other in a very interprofessional way. And his expertise was incredibly important in learning about all the endemic things that we just don't learn here in the United States that are endemic to that country. So very, very powerful learning experience. So for those of you who don't know where Ghana is, if you look up at the map of Africa there, it's in green. And the country itself, this bigger version of it, is here. And where we go, Sekondi is down here. So we fly into Accra, and then we travel by bus down to Sekondi, and that's where we spend the bulk of our time working alongside the Ghana Health Service and the University of Cape Coast. The objectives are achieved a number of ways through pre-departure planning, the group, the students that are engaging on this opportunity. We gather once or twice prior to going. We share a lot of email dialogue, It's not ideal, but we make it work, and we then embark on the rest of the journey. During the experience, we're working and learning alongside members that I talked about. We debrief every day, and that is a very powerful interprofessional sort of engagement that includes everything from huddling in the morning to debriefing at nighttime. And everybody engages in active participation in all clinical, cultural, and academic offerings. And we're not going to spend too much time talking about the faculty talking about what we do, because we know that you really want to hear from the students. But in a nutshell, that's how the objectives are achieved. And then after, participants gain everlasting friendships with the community health workers that they're going to talk about. They have tremendous gains in cultural competency. We've done research in the past and done pre, post, and 6-month post measures on not only students but health professionals that have gone. And the biggest gain that they've made is that immediate post to the 6-month post. It's when everything sort of settles in. And then giving back to for future participants. The reason they're here today is to not only market this program, but let you know how important experiences like this are in health professions education. There's another person I want to recognize today. He made the journey from Hampton, New Hampshire to be with us. His name is Chris Hosford, and if you wouldn't mind just raising your hand, Chris. Chris Hosford is a donor to not only the CAM scholarship here at UNE, but an adjunct to the CAM scholarship, which funds health profession students who want to participate in this program. A number of these students sitting over to my right wouldn't have been able to participate in this program without the scholarship opportunity. About a year ago, Chris asked myself and Tricia Mason what more he could offer in terms of the nursing scholarship as well as the Ghana scholarship. And it was really easy to ask. The community health workers that we work with are college students. They're mostly college bound. Their education is everything to them. And a lot of them don't have the resources to be able to further their education. So Chris agreed to a sum of money that would go toward scholarships for our community health workers. And we awarded the first 5 of the CAM Community Health Worker Scholarships this year to 2 nursing students, an optometry student, a teacher student, and an engineering student. And these lovely individuals up there have their certificates of award for the scholarships that Chris donated. So in addition to the wonderful philanthropy for our own students, he's also reached across the borders to help our Ghanaian friends further their education. And so the participants that went on this trip, one thing with health professions education and doing short-term study abroad is that we're doing clinical work. So we need the appropriate supervision for health profession students. So unlike other short-term experiences, we have more faculty that participate because we need more faculty. And so these are the folks from UNE and outside of UNE. And I'd like to especially recognize Molly Collin and Shane Foley, who are our outside participants, still affiliated with UNE on an adjunct basis, but not full-time faculty that joined us on this program. And I'm going to turn the mic over to Dennis Layton for a few more slides, and then we'll get going with the students.
Thanks, Jen. So this is the list of students that went. As you can see, these are all UNE students. Nursing, physical therapy, public health, social work. We also had a couple of pre-health profession students who just recently graduated from UNE, and then we have one culinary arts student from a different college. So these So these are the students that made the commitment to go. You know, they did get some funding with the scholarships, but they also had to, you know, pay some money for this trip. So, you know, it's like we say, it wasn't a vacation, and they really deserve a lot of credit for putting in the effort that it takes to go to this trip. I just wanted to talk a little bit about kind of what goes on while we're there. So this is kind of our daily schedule that we kind of loosely go by. The time zone over there is GMT, which is Ghana maybe time. That's kind of what we follow. But some people get up at 6 in the morning and go for a walk or a run or do yoga in the room or anything like that. Breakfast around 7:30. We start the clinic around 8:30. So we would split up. Half of us would stay on site. Half of us would go to the rural clinic. Close the clinic right around 1 or so when we finished up with the patients. Have lunch right after that. And then the afternoon was kind of free time, you know, to go out into the community. Dinner sometimes around 6 or so. Have a little bit of a debrief afterwards. And then on some nights we would have a guest speaker. So this is just showing some of the things that we did. This was our dining hall here, which was inside the church, one long table, which really actually worked out really well. You could see the quarters here, you know, a little cramped but comfortable. But you have to be able to, you know, live close together and keep your suitcase fairly organized. And then we have our laundry that's done for us. So we provide direct services. Very important to recognize we work with the Ghanaian Health Service. Like Jen said, we're not going over there to show how it's supposed to be done. We're working within the Ghanaian Health Service system. We're working with Ghanaian doctors, Ghanaian nurses, pharmacists, optometrists, physical therapists, all working together, as well as our professions all working together. So it's really a unique experience. So patients come in. They go through triage to kind of figure out exactly what services they're going to need. They get referred to where they need to go, and then we have physical therapy offerings, a lab service to do a lot of malaria testing, as well as you know, different some urine testing and things like that. A pharmacy that is very busy. Optometry, which was new this year because of our collaboration with Cape Coast. Many patients get set up on insurance. We get them set up on a year's insurance, and some community health education. So this is the clinic in Sekondi. So you can see at the far end is kind of where people come in. There's a waiting area. They get checked in, go through triage with nurses and physical therapists here. The providers, the PA, and the physicians down the middle, pharmacy on this side, this is the lab down front here, physical therapy over here, and upstairs to the left was the optometry department. So, you know, it's all right. If you want to talk about an interprofessional clinic, this is what it should look like right here. This is the Kansa clinic, so this is one of the rural clinics. And it's one big room and a couple of small side rooms, and then an outdoor courtyard. And all of that space was used with people divided up. So, you know, this just shows how you just work together in these places, and you make do with what you have. Mary's cleaning a wound here, you know, with a plastic chair sitting outside, because that's what was available at that time. This is the Mpintsin clinic. This is the one that my team went to. And you can see we were doing things outside. We were doing the vision tests outside because there just wasn't enough room inside. This is actually a school, and we had half the school, so there were classes going on in the other half. And we were in, we had basically kind of 2 rooms on our half. So getting checked in here, nurses working here with triage, and physical therapists playing outside while the nurses were inside doing triage. So I want to hand it over now. We have some nursing students that want to come up and talk to you about their role over there, as well as I think they're going to talk about pharmacy too.
Okay, so kind of the nursing role, when the patients first came in, we were the first people that they saw. They would come in and sit with us, and we would do triage with them, so kind of get like their top 3 complaints, which was a little tough sometimes, but and kind of figure out how long it's been going on and that kind of thing. And then we would take their vitals, and then based on what problems they were having, we would either send them straight to the physician or have them get a vision test or send them to PT. And then for when they were leaving, they also had to come back to us before they could leave. If they had to go to the pharmacist and get any medications before they left, we would go over their medications with them again, have them teach back to us how they're going to take them, so we make sure that they know what they're doing with them and make sure that they don't have any other questions with those. What did I do? And we also helped out with wound care along with physical therapy. We saw a lot of pretty nasty wounds, but it was really interesting. And then we also did some lab work too. There was a lot of malaria testing because that's really common over there. And we helped out with pharmacy because we were helping out with the medications and everything, making sure that the patients knew exactly how to take their meds and everything. And we also did some vision tests and referrals to the optometrist and everything in Sekondi.
So another part for the nursing students that we got to do is we got to experience some of external clinics, so it wasn't involved with the clinics that we hosted. One of the pharmacists that was on my team actually volunteered his time to take us to visit his clinic, which was this one was more in the urban setting, and it was a maternity clinic along with, so we were there and we missed a birth by about, I think, 3 minutes maybe. So we got to see the newborn baby, and then we saw the outpatient setting of all the pregnant women waiting to see the doctor during their pregnancy. And we also have a rural clinic with, that was both. It was maternity, which I think we just missed a birth there as well. And there was pediatric section. It was kind of just an experience for us to see how they work in their environment. So not our setup, but like actually seeing a nursing role where they would work over there. And it was a very interesting and incredible experience to observe. Some of the things we focused on was the signs they had up, so what they were focusing on, their posters, like what they were displaying for their patients to focus on. A lot of it was on maternal care and safe ways to prevent pregnancies and etc. Another part was the challenges for us. So one challenge was, like Maggie said, we tried to pick their 3 top problems. So people would come up to us, we'd ask what's going on, and they would have like a list of 10 things that were wrong, and this would all be through the translator. So we would try to pick the 3 things that are causing the most issues for them. The cultural differences, almost everyone complained of, when it was translated back to us, it was waist pain. And so we would send them, obviously for us, we don't know what that is. That could be internal, it could be from like PT related. And PT eventually found out that waist pain means back pain. There was a lot of fighting over care because while we were over there, their doctors were on strike, so this clinic was a very big deal for them. So that was hard for us to see the line outside of what people would do and having to send people away. So the multitude of people. And then prophylactic care. We saw a lot of people wanting stuff just to use for later, especially the malaria pills, because they knew they were going to get it again at some point in their life. So they would want that to just have for the next time they got it. So those are just some of the challenges, along with the language barrier. That was obviously the biggest challenge.
Thank you. Okay. So a little bit about the pharmacy. We do not have the professor here today. So I know a lot of the PT students, the nursing students, we really interacted with the pharmacy professor. So even though we weren't pharmacy majors, we were really hands-on with understanding what we were giving our patients, and we were responsible for the education in that aspect. So Emily was kind of the head of everything. She led us in what she really wanted us to do. So not only did we have a role as a pharmacy technician, but we were also the educator. I know for the Mpintsin group, there was also T. He was a Ghanaian pharmacist, so he was really hands-on with educating us as well. I know for something like Tylenol, it's called paracetamol there. So it was cool for us to see that, you know, we're giving similar medications, but they're different in that culture. And not only in the education aspect, we had to teach them when to take it. Do you take it with food, without food? And we were also doing this through a translator. So medication for, you know, in your own language is very difficult to understand. So trying to translate that in language that is going to be easy for our patients to understand, and then they're going to follow through with it. So again, the medication safety and dispensing, we had little cards that we would write on. So it would be a sun rising if they were supposed to take it in the morning. It would be a sun setting if they were supposed to take it at night. We would write with food or after food if the med had to be taken in that way. Our community workers were amazing. If we weren't able to translate something in a way that was really easy for us to understand, they would word it in a way that their language, in Fanti, they would understand in their language. So a lot of these meds were malaria. Almost all of our patients walked away with a prophylactic malaria medication or a deworming medication. So not only were we educating at the pharmacy area, we were also educating with the nursing, and PT also interacted with outtakes. So you're educating them twice to make sure that they're following through with these medications. And then just a little bit, these are just pictures of some of the meds that you would give. As you can see, they do look a little bit different, but their role is the same. They have a little bit different of a name, but education-wise, it really was similar to how you would do it here.
Okay, that works.
So I'm Kirsten, and this is Matt, and we're PTs. So just to talk a little bit about the PT aspect of this whole trip, as the nursing student said previously, a lot of patients came in with waist pain, which we figured out was mostly low back pain, but a lot of other overuse injuries. We had some pediatric patients with developmentally delayed presentations, and then a lot of wound care, which we worked with the nursing students, because we had PTs from the class above us that were taught wound care stuff, but our class had yet to be taught that, so we were kind of unsure of what to do. So we got some help from the nursing students, which was nice to do the interprofessional collaboration with that. So other than just the general PT kind of stuff, we also did vision screening, which you can see in the bottom left corner. That was Matt at Mpintsin. We were outside doing that. We also did it at the other clinics, helping nursing. We helped with lab stuff because usually the beginning of the day in the clinic, intake was really busy and the nurses were really busy, so we would kind of spread ourselves out trying to help in lab, doing the vision, that kind of stuff, wherever we could help. So we also, in the right side of this slide, that's Isaac, and the PTs had the opportunity to go to the University of Cape Coast, the Central Region Hospital, and EFIA Hospital to kind of go and both observe and help hands-on with the PT clinics there. So we got to see kind of how they run their PT system, basically, and we helped where we needed and kind of bounced ideas off each other of how we could make our practice better and how they could maybe help make their practice better.
Language differences, okay. There's certainly a lot that we could speak to that, no pun intended. So we would work with the community health workers a lot in physiotherapy because a lot of physical therapy, physiotherapy is talking to the patient, a lot of one-on-one stuff. And it was interesting. I'm not sure all of what we said directly translated. Like that middle picture there is me talking to a patient with her daughter, and that conversation took maybe about half an hour just to like figure out what was troubling the patient. But it's, once you get past that language barrier, I mean, we all kind of understand the language of pain. It's sort of the same thing to everybody. And that's where we have that connection. So language gets in the way, but eventually we're all speaking the same language. That's the wrong way. There we go. Some of our challenges. Fufu apparently was a big challenge for Dennis. He is not a big fan of fufu. Fufu is a local cuisine. It's several starches pounded together. And you serve like a sauce or fish or something over it. You scoop it up with your hands and eat it. It's apparently delicious, except to that man right there. So other cultural differences, I mean, it really kind of depends on where you live, but I mean, here most people have a washing machine, or at least a laundromat that they can go to. Over there, everything is done by hand, dried on a line, and normally it would be dry the next day, but for some reason it rained like every single day we were over there. Dennis told us not to worry about that it would never rain. It had only rained once previously till we got there, but so I guess that's on us. I think we brought the rain. And then the sleeping conditions. I think you saw a picture of the women's quarters, very close. The men's were very spacious. Yeah, women, keep going to this and, leave a lot of space for the men to spread out and sleep. It was great. Yeah, go for it.
The other thing I wanted to add for this, like when we were talking to patients about what was bothering them, when we asked what their occupation was, I think I heard someone tell the story when they originally had asked someone, like, they said when they do their laundry, their back hurts, and someone was like, oh, do you have a top-loading or a front-loading washer? And it was kind of like, well, that's not really applicable in this situation. So you kind of had to think of that, and like a lot of the overuse injuries, people working in the market, some people had to like grind different foods, always using like the same technique, one hand over the other. So they had an overuse injury in one shoulder, and you kind of had to think of like really what does their occupation entail, and like that's why they have this injury. So you kind of had to work with them on maybe switching it up and going the other direction to kind of prevent that kind of stuff.
Yeah, that was a big part of our treatment was patient education, just ergonomics, the way people use their bodies was it's stuff that nobody really ever thinks about, but if all you have to sit on is a tiny stool that is too small for you, you're going to be bent over and it's going to make your low back or waist hurt. So, yeah, I thought I had a transition sentence, but I don't. More challenges, okay. Home exercise programs. Since we would see a lot of these patients only once, some we would have come back in, but the majority we'd see once. So we'd do what we could to alleviate the pain, and then a lot of it was just kind of on them to continue with their stretching, strengthening programs to kind of heal themselves up. And that was also a little difficult due to the language barrier. Fortunately, this last year we had a few pamphlets printed out with no wording on them. They were just pictorial instructions. So you could find something that generally resembled what you wanted to do with the patient. You'd take them through that. You'd have them teach it back to you. And I think it worked out pretty well. So that seems like something that we should continue with. As mentioned before, we were involved with some pretty gnarly wound care. Very, very interesting. I think I covered the exercise expectations. But some patients we would see multiple times. That little boy right there had CP. So we saw him at the beginning of the program, and he kept coming in every single day so we could work with him. Eventually, we taught his mother several exercises that she could do with him, and hopefully that'll improve his quality of life a little bit later on down the line. Lab. I think people have talked about the lab. Have you guys talked about the lab yet, or was that just farm? Okay.
So a little bit about lab. So our public health students were primarily in charge of this, and we did have a professor there, Jen Gunderman. And she is not here today, but she has a master's of public health. So while they were there, they were kind of tracking the difference between different types of malaria testing kits that we were doing. But we were testing for malaria, we were testing for pregnancy, urine screening, glucose tests. And by the end of it, you kind of could refer people straight to the lab if they were complaining of, if they have a headache, if they have waist pains, if they have a weird taste in their mouth. We pretty much inferred that it was malaria, and you would send them for a test. Sometimes it came back negative, sometimes it came back positive, but I know that we got a lot better at nursing intuition or PT intuition at kind of understanding the screening process and saying, okay, these signs and symptoms kind of point to this, so let's screen them before we send them to the physician, because I know the physicians, we were sending a ton of patients. So if we can screen the patients before sending that to them, it saved them a lot of time in trying to understand what the patient was complaining of. Insurance. Do you know the number of people we insured? About 300. So we insured about 300 people. I know that the cards are being counted up, but when someone would come in, during intake, we would either say whether they had insurance or whether they didn't have insurance. And if these patients have a chronic issue, we would send them over to the insurance table if they didn't have insurance. A huge problem over there is hypertension. People wouldn't blink an eye. They were having blood pressures of 240 over 160, and that's nothing for them. And then we're like 240 over 160, you need to change that like immediately. That's a big problem. So a lot of those patients we would send over to get insurance. That way they would have a whole entire year's worth of blood pressure medication. And the good thing about insurance is when you insure somebody, you insure their whole entire family. So what's the price of one family? Yeah, $35 US for a whole entire family of insurance. We pay more than that per month. So to help these patients out for a whole entire year's worth of insurance, if you think about it, if we insured 300 people, that's going to be amazing for that community of getting a whole entire year's worth of help. So a little help from our friends at the University of Cape Coast. Does anyone?
Again, just going back to the beginning when we talked about the special partnerships, the University of Cape Coast, with the blessing of Dr. Azeez, supported us with a number of optometry students and optometry faculty, as well as nurses, a driver who drove, a bus who drove the students and the health professionals from UCC back and forth every day. physicians, nurses, so on and so forth. And they were our guides in helping us really stick with the Ghana Health Service guidelines, the clinical practice guidelines that we followed along with our partners. And so that was really quite special. And it always has been a very special partnership. So I'm going to let students take over a day in the life, and we can actually rove the mic around to help.
Does anyone want to share anything? No? Okay, we'll call on them for stories. So a lot of our time we spent in Sekondi and Takoradi. So Sekondi is where we had our main clinic. Then we had the 2 clinics in Mpintsin and Kansawarado. Takoradi is where we kind of went for a lot of our cultural immersion. So we would go into the markets. And if you see the fish picture right here, that's the sign that you are in Sekondi. That's their kind of, that's their home, you know, when they see this. And you can see in the top, that is one of the Sekondi markets. So, and this is the Takoradi markets. So they would literally line everything up on the side of the roads, and it's anything you ever think you would ever need. Your clothes, your shoes, your food, your baby care, anything along those lines, you would get it there. Very fast-paced, and the cars there work differently. They have the right of way. So they kind of merge wherever they want. So when you're walking on the sides of the streets, you really need to be careful of where you're walking and kind of be conscious of what's going on. And then just fishing. Fishing's a huge part of their community. So you would walk through the markets and they would have, you know, fish drying out, or a lot of our meals that we actually had there were fish. We actually, by the end, had options for vegetarian people because we had a lot on our trip, but fish is huge in their community. So like we said, the fish. This was the woodworkers where we went. They had paintings, clothes. I know a lot of us are wearing the pants that we got in the market. And just pictures of kids. They kind of, when you go there, they love seeing you. So they try to grab your attention and talk with them on the streets. They love having you there.
Okay, so on that top right picture, on our last day there, we went to the Elmina Castle, and that was a castle that was used during the slave trade to hold slaves there. So we had a tour of that, and it was really amazing. And we got to see like where they held all the slaves, and they had like hundreds of slaves in this little tiny room, and they had this thing called the Door of No Return, and they would bring the slaves down this little tunnel and through this little tiny door, and they would send them off on a boat to be sold, and that they called it the Door of No Return because they knew if someone went through there, they weren't coming back. So that was really interesting to see. And then we went to, the group picture is us in all of our church outfits that we had made there. We went to the church service on Sunday there, and church is nothing like it is here. It was probably like 2 hours long, and it was a lot of singing and dancing, and it was really, really fun, and we all loved it. I would definitely go to church a lot more if it was like that here. And then the left picture is one of the dancers. We got to see an African drumming demonstration, and you can kind of see the drummers behind her a little bit, but they were really amazing. They did all these different dances for us, and then some of the drummers actually got up and did some dances too, and then they were doing like stunts, like standing on each other's heads and like with chairs and everything, and it was really cool. They were really talented.
So another part of our cultural immersion, we got to spend a day in Kakum National Park, and in Kakum we went to on their, I guess, what would you call it? Canopy walk, and so we were 315 feet in the air. I think there were 7 7 links of a walk attached to trees. And it was probably one of the scariest but best things we've ever did. Unfortunately, you couldn't really see underneath you because of all of the trees, and it was daylight, and they said that the animals are more active at nighttime. I know some of us were really hoping to see an elephant, but it didn't happen. But it was a very interesting experience being in a rainforest. Soccer games, I know I went to one of the local games down the street from where we were staying. They take it very seriously. You'll always see kids playing soccer wherever, and then the men's leagues are really intense. I know some of our guys on our trips were playing soccer probably all 2 weeks. They got really into it. The local markets, both, like they said, we went to markets in Sekondi and then also in Takoradi, and you could shop for anything. Everybody has bracelets and clothes, and there was a lot of overwhelming experience for someone that's never been there before. The markets are very consuming and small, and there's probably more stuff there than you could ever find at one of our malls. But it was very interesting to see how they shop. You'd have clothes next to food, and it would be perfectly normal for someone to be filleting a fish next to whatever you'd want to buy for your home goods. But that was one of our other cultural immersions. And now I'll pass it on to Dr. Morton, or nope.
Can I talk about this one? You can talk. Do you want to do this one? So this is, one of the things about going on, yes. Dr. Azeez, we do it once and then that's it, okay? All right. One of the things about going on this trip, that some people might criticize is that you go and then you leave, and there's no follow-through. So this little story shows some, that because we go every year, there is follow-through. We do see patients year after year, get them on insurance, we get them in with the community health workers, we get them into the system, and then we see them again when we go back. So this little girl here, we first saw about, I think, 3 years ago, and one of the nursing students during triage listened to her heart and said, that's not right, and found that she, identified that this girl had a very serious heart defect, which I can't even pronounce what it was, but it was a very serious heart defect. And so she ended up having some testing done, and it was, fully diagnosed, and it really needed surgery. So we came back a year later, and it was, the family came in to see us again and said that they, were raising the money to go to India to have the surgery done. So we decided as a group that we were going to take some of our funds and donate it to their cause. They picked up the last amount of money that they needed, and shortly after we left, this little girl and her family went to India, and they were in India for like 9 months, I think it was, to have that surgery. So the picture on the right, when we went this past August, was her coming back to visit us after she had had her surgery. And her heart isn't perfect, but she's going to live a life now. She had a big scar down her chest, and to have her come back after we had seen her over the course of 3 different years, and I think really one of the nursing students was the person that actually found that this little girl has a serious problem, and you kind of wonder what would have happened if that hadn't happened with that nursing student. So this was really, a real. This was a real success story. All right, moving on. So we want to say thanks to a lot of people. Reverend Ando is our host. Reverend Ando is in the center down here right after church. The physicians, nurses, pharmacists, optometrists, physiotherapists, all the people from the Guinean Health Service that we worked with and from University of Cape Coast. This is some nurses up here. We really want to thank some people that came with us. Molly Collin, Shane Foley, who is the PA who graduated from UNE and went on the trip as a student and then returned now as a PA. Molly is an adjunct physical therapy faculty who stuck her head in my office one day and said, hey, if you ever need somebody, I'd be interested in this trip. And in August, she was going to Ghana with us. Jamie Keith is a student who went as went 1 year as a student and then came back another year as a student. And that's on that second trip really took on some leadership responsibilities that were really important. People back home, Tricia, who kind of keeps the whole thing organized for us, and the WCHP Dean's Office, which has been very supportive of the trip. So there is a website, there is some pages on the UNE website if you're interested in seeing more pictures and hearing more about it. So that's the end of our slideshow. I'd like to bring Jen Morton back up to kind of wrap things up.
So usually what we try to do is open it up for stories and shares with the audience. If there are any prospective participants that want to know a little bit more about it, but our students also sharing some of the stories that were very powerful clinical stories from Ghana. So do we have any questions, specific questions from the audience? Okay. Any students that want to share any nuggets from the experience that were compelling? Yes.
So one thing I really wanted to share was I was obviously expecting a big experience where you go outside your comfort zone in another country, but I wasn't really expecting something that would put me so far outside my comfort zone in the terms of like healthcare. So I went on this trip as a med bio student graduating pre-PA. I'm now a nurse practitioner student. I kind of had decided that ahead of time, but because I was in between majors, they had me switching all around the different areas of the clinic. So I was in the lab, I was in nursing, I was in the pharmacy. So I got a well-rounded view of everything there. But what I didn't expect, the first day of lab, I kind of just got thrown into the pharmacy, not really expecting it. I wasn't really sure what I wanted to do with it. And I ended up absolutely loving it and spent the rest of my 2 weeks in the pharmacy as a pharmacy technician. And I came home and got a job as a pharmacy technician at a pharmacy by my house. And I'm doing that part-time now since, and I love it, so, yeah.
I guess what I would say is that I think when we went there, we all knew that we would be directly helping patients, or we hoped that we would really be having a big effect on our patients. But I think what really struck me was the last day we were there was the effect that we had on all the community health workers that we worked with and the people in the community. I think at one point I had a little boy run up to me. I mean, when you're in the community, there's kids, they're in every window around the building just looking at what you're doing and so interested in you. And one little boy came up to me, and I think Babson College had been there for business, some sort of trip like a year before, and he had a Babson shirt on, and he asked me if I knew his friend Eric from Babson. So they remember you, and they definitely you have a lasting impact on them. On our last day, I think it really struck me that our community health workers, who I thought were so sick of us, they were literally keeping us from falling in holes when we were walking around the streets, and literally babysitting us while we were taking pictures and moving us out of the way from moving cars. I was like, they must be so sick of us by the end of those 2 weeks. But they were very emotional when we left, and a lot of us have stayed in touch with them via Facebook, and it was cool to see the impact we had on just the community as well as the patients. So.
A big thing I noticed was they said that they were going to miss us a lot, which we knew, but they kept telling us, oh, you're going to go back to the U.S., you're going to be busy, you're going to forget about us. And no matter how much we told them that we knew we had an impact on them, no matter how much we told them, it was more of an impact on us that they had. They didn't believe us. And I can say now, being back for how many months, there's probably not like a week that goes by that people aren't remembering something from this trip and something that happens. I know most of us always are wearing something that just is a little reminder that it's there. And all of the kids that we saw and the patients that from like a little girl that I treated with who stepped on a nail, and I treated her the first day, and I went off to a different clinic. And every single time I came back from that clinic, she came back to get wound care from other people, and her mom would always come back up to see me. To an 80-year-old, or I think 90-year-old woman that we worked with PT, and we gave her a walker. And for how many, I don't know how long of her life, but she was living her life with her back completely bent over. And when we gave her a walker, she stood up for the first time straight, and I don't know how long. And just the little things that we might have done a lot for them, but they have no idea the impact that they had on us.
There was one patient, like, you remember all the big things and like the nasty wounds and all that, but there was one patient that I had seen so many people that the little things that you don't do much with the patient, sometimes you don't remember all of them. So there was one patient that came back, and it was like 4 days later, and she went up to the community, one of the community workers, and said that she was looking for me, and I didn't know who she was, and she came in, and she came looking for me and Jen, and she brought us both these beautiful dresses, and she said I had checked her blood pressure. That was all I did, and she like gave me a hug and kissed me on the cheek, and it meant so much to her that I just checked her blood pressure. And it's just like, even the little things meant so much to them.
Yes.
I'm curious about the people who went a second time, like they've gone as a student and they went back. What was it like going back? How was the experience different for you?
It was amazing. I definitely was interested to come back and see what I had, what I had thought about it the first time and how much it had changed, and it has an even bigger impact on you because you know what kind of experience you had the first time and how much more you can do the second time. I plan on going back every year, so I don't even know if I can really put it into words. So.
I can tell you that we've had, every year, we have a student come a second time, at least one, or alums come back. I suppose we ought to run the data, but I think it's about 8 to 10% are returners. And we encourage that because we know that we know that it's advancing really good work in a lot of ways. And you know, health professionals start to make it a part of their work life that service in any form is important, but service, this becomes their service moving forward. So I've already had a number of these students inquire about going back. So we know that it becomes part of what they really want to spend their life doing in some capacity. So, any other questions? Any other really good stories that anybody would like to share? Wonder about you know, when you hear a nurse say a really, how did you describe the wound, Maggie? Nasty wound, that's it. That means it's a really exciting thing, just so you know. But I wonder if we would like to tell the story of the little girl with it was a rule-out guinea worm, and it turned out to be, I think, a hookworm or something. But I think this really demonstrates how when we have very little training in tropical medicine, sometimes our assumptions aren't correct, but when we have an expert who sees it every day, that education helped us to treat that condition appropriately. And I wonder if Dora and KK would like to speak to that.
Well, I think this was a girl whom I saw, I think the first time. Several of us saw her together. And I had spent time in Africa years ago in the 1980s and 90s for probably total about 1.5 or 2 years. And guinea worm was really common then, and it looked just like guinea worm. So I said, oh, I think this is guinea worm, but it had a secondary infection. But then she came back, we had to come back because it was quite infected. And so she came back the next day or so, and Dr. Azeez was there. And he said, you know, we haven't seen guinea worm in years. And sure enough, I Googled it, and it turned out it's been eradicated almost, because shows you how long ago I was in Africa. But, and actually it was the Jimmy Carter had raised money to eradicate guinea worms. So, and it happened to be in the news in August because I think he came down with cancer or something. But anyway, it showed how Dr. Azeez knew immediately that this was hookworm. And it showed that even, you know, I might have been trained in the States, but you don't know, you're not trained in health issues from other countries unless you're trained in that country. So it was a great example of how we really learned from and with and about each other. And I think one of the things that really set this experience apart for me, compared to my experiences years ago, was that learning from and with and about each other. And I learned as much from the students there. I mean, I had never worked side by side with a physical therapist, so it was fascinating. I learned so much from them and how, you know, they approached things, and from all the students. So I don't think there's one of us that isn't touched by having learned from our Ghanaian colleagues, the community health workers, and each other's, including colleagues and faculty as well as students. So I just wanted to also give another shout out to, and I forgot the donor, Chris Houseford. I mean, this is just, I think there is just not one person that goes on this trip, this immersion experience, it doesn't come back really changed. And I know it changed me a great deal, and I will never practice the same as I did before. It really has a profound impact that is lifelong. So thank you so much for your incredible generosity.
And I will just add on that case of the little girl with hookworm that she appeared fairly early in our 2 weeks there. And so between the physical therapy students and the nursing students and all of the students that treated that wound after Dr. Azeez, did you lice the? That she was smiling and almost completely healed by the 2 weeks. It was a very longitudinal process. And I will also, comment that this partnership with the health service and with UCC has made our work much more family-centered. For a lot of students to go to one place and practice alongside the health service and UCC builds trust within the community, and this is something we've been working on for 15 years, but it really allays the fears and anxieties of the community, and working alongside our colleagues with this really rich knowledge really ensures that it's all okay. So.
I'm going to just say real quickly, just one real quick story. I had, the way the system works over there, or the way our clinic works, is we have these cards that we hand out. So that if you get a number, you basically are going to be a patient that day. And at the end of the morning, it starts to run, we start to run out, and we have limited numbers. And there was a woman that came in with her son, both very, very sick with malaria, and they happened to get one card. And the woman gave it to her son. And, she didn't even complain that she also had malaria. And I think it was, again, one of the students that picked it up and said, I think Mom is as sick as this kid is, and we need to see both these people. But you can't go over there and see that and not be changed by something like that. But that's my short story. My larger story is this. I first went over in 2011, but Jim Kavanaugh was the first physical therapist to go over in 2009, and he went over with 2 students. And I remember when he came back, he made the comment about that it's much less of the faculty-student relationship that you have, but it's much more of a collegial relationship. So if you're thinking about going, if there's anybody sitting here who's thinking about going on this trip, that's really the setup over there, is I do as little work as possible when I'm there. And the students really do, almost all the work in the clinic. And as faculty, we're really just there to supervise and to be there for support, and so you really are in the trenches as a student maybe for the first time. And when Jim made that comment, that kind of stuck with me, and I really saw it when I went, and I know Molly, I think, saw it when she went this year, that you just kind of let the students go, and you see these nursing students doing things and talking about stuff that you're just amazed that they know as much as they do at this level of their education. So that's been a real deep experience for me, to be able to work with the students instead of being their faculty member.
Sorry. Just to add on to that, I know, I'm a nursing student, so a lot of what we rely on is technology. So I'm on a tele-unit right now, and if someone's in AFib, I have a monitor telling me someone is in AFib. I had a patient come in, and I was like, their blood pressure is not right. Why is it ticking? That's not normal. So I was like, let's feel their pulse. Okay, that's not normal too. So I did a cardiac assessment, and I was like, I don't know what this is, but I was like, I know this isn't right. So I called over to Jen, and she's like, this person is in AFib. They probably have chronic atrial fibrillation. And I'm like, it's humbling to know that you really know as much as you do, and you're walking away. I know personally, us nursing students, we're like, wow, we know nothing. But you get out into the field, and you're like, I know so much information. And this was the first time when we were actually able to apply a lot of it, and you walked away feeling really confident in yourself, and that was a good feeling.
Our provider students and our nursing students always come back saying that this was the best advanced health assessment or a health assessment class they've ever had, because of the fact that the technology isn't there to back up what you're listening, palpating, or visualizing. And so it's really humbling for us as educators to hear students say, I know more than I think I know. The other thing I just want to mention is our students have been our biggest drivers for clinic refinement and quality improvement. And I'll give you just a really quick example. As these clinics grow, and this particular clinic I believe we saw over 650 patients over 2 weeks. One of the gaps that we've seen in looking back on our data is that perhaps somebody left without their medications, or perhaps somebody didn't get that follow-up teaching. Well, in going back and picking up on this practice gap, we implemented, and again, this was student-driven, we implemented quality improvement this year in that we had not only a check-in or triage or intake, but we also had outtake. And we closed the loop so that every single person that was supposed to see them saw them and signed off on that. And so that was a huge thing, and it's not, there's a number of things, and they've almost all been student-driven for quality improvement. Yeah.
There's one striking thing that you didn't mention. Before we started a clinic, every member of the team actually went through all the service points. Yeah. I remember I met Dora. That was the first time she took me through things I've practiced for over 22 years, things I never imagined in healthcare. And I was so excited. I even went to Emily Pharmacy. She took us through what exactly she was going to do for the 2 weeks period. We went to PT, they took us through. We went to the intake area, they took us through. So every member of the team knew exactly what every other group are doing. And therefore, it was easy to crisscross. In the event that the physical therapy are short, we can easily crisscross from lab to the physical therapy and vice versa. So that was one innovation that I thought, as a person, I learned greatly just within that 2 weeks. I'm so pleased to be part of the team.
Thank you, KK. So again, just going into clinic mode, everybody really worked hard to develop these areas of training so that people could go out and feel comfortable. And it really builds off a military model of what training, going to a certain area, training very quickly to execute what you do based on your skills. So I want to thank everybody for coming. the students are here to answer any questions if you have any questions, but otherwise, thank you so much.